Welcome back, my dear doctors. Now we are going to start with one more new important topic in neuroanatomy, that is brainstem, guys. It is one of the most important topic. Why? Because we are going to learn a lot of stuff here. For example, first of all, I am going to teach you about the structure of brainstem, that is ventral aspect and dorsal aspect. And after learning all the things related to the ventral and dorsal aspect of the brainstem, then we are also going to learn the transverse sections at every level, the midbrain, the pons and medulla oblongata. And later on we need to even correlate that with the lemnisci, the tracts, and later on I am also going to teach you about the syndromes. So this is like important segment of neuroanatomy, and you have to study all these things in the same order as in which I am teaching you guys. Okay, so let's get started right now. Now let's start from the scratch as usual. Every medical student knows that brainstem is made up of midbrain. Number 2, it will consist of pons, and number 3, it will consist of medulla oblongata, guys. So brainstem will consist of midbrain, pons and medulla. Now let's draw the same diagram that we have been using from the very beginning of neuroanatomy. So this is your brain and the spinal cord, and in this somewhere here, this is your midbrain and this is your pons and this is the medulla oblongata, guys. Fine. Now what is the important concept that you have to learn related to this brainstem? Remember, from the brainstem, the cranial nerves will originate. Okay, so in total we have got like 12 pairs of the cranial nerves, but all the cranial nerves are not beginning from here. So you need to understand in this manner, try to learn in this manner, guys. The cranial nerve number 1, olfactory, will be from here. The cranial nerve number 2, optic, will be from here. So leaving 1 and 2, olfactory and optic, leaving 1 and 2, remaining all the cranial nerves will be from the midbrain, pons and medulla oblongata. They will all be from the brainstem. So follow this method here, guys. So which cranial nerves are going to originate from the brainstem? Right from the cranial nerve number 3, that is your 3rd, to 12th cranial nerve. And that is what exactly I am going to teach you here. Today we are going to learn which cranial nerve exactly is going to come out from which part of the brainstem, guys. And to understand that, let us draw a simple schematic diagram here first. So imagine this one here to be your midbrain. Okay, I'm not drawing that cerebral hemispheres and diencephalon above. Okay, so you're just starting from the midbrain, and followed by midbrain you'll be having your pons and then medulla oblongata. This will be the pons and then medulla oblongata, guys. Now between the pons and the medulla there will be a junction, and this junction will be referred to as pontomedullary junction. Pontomedullary junction, guys. Now, out of that 3rd to 12th cranial nerve, remember 3rd and 4th, the oculomotor nerve and the trochlear nerve, 3rd nerve and the 4th nerve will come out, will exit out from the midbrain. Okay, but in this, one important concept that you have to understand is, for example, if this is your brain and the spinal cord here, guys, same again in the striatal section. Remember, the cranial nerve number 3 will be originating from midbrain, but ventrally, guys. The cranial nerve number 3 will be originating ventrally, whereas the cranial nerve number 4 will also be coming out from midbrain only, but that has got a dorsal origin. Then after that, it is going to take a turn and come in the front. So try to understand like this. For example, if this, my hand here is like midbrain here, if this is your midbrain, cranial nerve number 3 is originating ventrally, no doubt about that. But the cranial nerve number 4 is having a dorsal origin, then it is going to take a turn from a side and then come in the front. Now you might be thinking, why sir is like stressing a lot at this simple point? Why? Because all your cranial nerves has got ventral origin, except for the only cranial nerve which has got dorsal origin will be the 4th cranial nerve, that is your trochlear nerve. So the only cranial nerve which has got dorsal origin will be the trochlear nerve, the 4th nerve. So that is a point which you have to make a note of. So from the midbrain you have got the cranial nerve number 3, that is your oculomotor nerve, ventral origin, and the cranial nerve number 4 taking a dorsal origin, then taking a turn, coming in the front. Whatever, 3rd and 4th nerve will be originating from midbrain. Then the next one, pons. The only and only one cranial nerve which will be originating from the pons here, which will be coming out from the pons, will be your 5th cranial nerve. That is the 5th cranial nerve, trigeminal nerve, thickest one as well as the largest cranial nerve, that is your 5th one, sir. Then the cranial nerve number 6 and the cranial nerve number 7 and the cranial nerve number 8, sir. The 6th one as well as the 7th one as well as the 8th cranial nerve will be exiting out, will be coming out from pontomedullary junction. And you have to remember that in the same sequence, first there will be 6th nerve, lateral to that there will be 7th nerve, and lateral to that it will be the 8th nerve. Then after that, welcome to the medulla oblongata. In the medulla oblongata, there will be a sulcus here, depression. There will be a median sulcus. And because of that sulcus, on either side, you'll be able to find the elevation here. So there will be one elevation here and there will be one more elevation here. This is said to be the pyramid and the pyramid. Then lateral to the pyramid, you'll be having like one more elevation here, and this will be your olive and olive, guys. Let me just write down the full name here. So this will be your olive here, and this will be the pyramid here. Now, lateral to olive, you'll be having cranial nerve number 9 and 10 and 11 originating here, guys. So the 9th nerve and the 10th nerve and 11th nerve will come out lateral to olive, and the 12th nerve will be coming out between the pyramid and the olive, sir. This is the 12th nerve. Fine. So this is just a schematic diagram so that you people actually get an idea like exactly which cranial nerve is coming out from where. And don't worry, within few minutes I'm going to show you exactly the diagram in the atlas, guys. Fine. So this is just a schematic diagram for an idea. So now you all know very well the 3rd and 4th cranial nerve will be originating from midbrain. The 5th will be coming out from pons. 6th, 7th and 8th will be coming out from pontomedullary junction, and then remaining all 9, 10, 11 and 12 will be from medulla. And to learn in depth, 9, 10, 11 lateral to olive, and then 12th one is between the pyramid and olive, guys. Perfect. Now once you have this idea, now let us do one thing. Let's go back and see first of all the image in the atlas, guys. The atlas image. Now in this diagram, without any doubt, you'll be easily able to understand this one will be the midbrain here. This will be the pons here, and this will be the medulla oblongata, which will actually continue down into the spinal cord. And behind the pons and medulla, you are also able to appreciate cerebellum there, guys. Fine. Now what I'm going to do is, this diagram of the brainstem is actually in the sagittal section, exactly in the center. Now I'm going to turn that, and after turning that, we are now going to see like the ventral aspect of the brainstem. So this diagram of the brainstem is actually the sagittal section. So now what I'm going to do is, I'm going to turn that and see what is or how it looks like on the ventral aspect. So the moment I turn this, the image will be something like this. Wow. So this is the ventral aspect of the brainstem. And do one thing, guys, the moment you see these kind of, complicated images and all, don't get panicked in the exam. Okay. Just try to always start from the known part. So below you're able to appreciate the spinal cord. Just above the spinal cord will be the medulla. Okay. Above that, this big bridge-like structure will be pons. And above the pons, you'll be having the midbrain. Fine. That's your midbrain, pons and medulla. Now, let us just cross-check whatever I have said you just now. Let us just cross-check. Yes, can you see here? From the midbrain, are you all able to appreciate here? That is the cranial nerve number 3. And then there will be a cranial nerve number 4 originating dorsally and again taking a turn and coming in the front. 3rd and 4th nerve will be from the midbrain. And then from the pons, the only cranial nerve originating here, the cranial nerve number 5. That is the trigeminal nerve. And there I want you all to appreciate one more thing. You are able to see like 2 components. Don't get confused there, like 2 different nerves. No, those 2 components belongs to 5th nerve only, trigeminal nerve only. Trigeminal nerve is actually a mixed nerve having sensory as well as motor component. But remember, trigeminal nerve, yes, that thicker part is representing the sensory component of that, and the thinner one will be the motor component of that. Fine. Then now look at that pontomedullary junction. From the pontomedullary junction, I am able to see the cranial nerve number 6 here. Okay. Lateral to that, you'll be able to find the cranial nerve number 7, these 2 components here. Okay. And again the same thing, there will be one sensory, another motor. But here the thicker one will be the motor component. Why? Because facial nerve will be predominantly motor, whereas trigeminal nerve will be predominantly sensory, guys. And then lateral to that, it will be the 8th nerve. That's your vestibulocochlear nerve. So 6th, 7th and 8th will be coming out from the pontomedullary junction. Now after that, if you see in the medulla oblongata, again the same thing, this elevation here is pyramid and this is your olive here. And lateral to olive will be the cranial nerve number 9 and then 10 and then 11. Between the pyramid and olive, there will be the 12th cranial nerve. So that is hypoglossal nerve. So that is what we have just now drawn the diagram, our schematic diagram, guys, which is absolutely true here. Understanding? So now we'll do one thing, we'll even draw this diagram also, so that in the exam, if they give you this kind of images, my students should not have any fear, guys. You can easily identify in the image or in the exam, guys. Is it okay? So let us now draw exact diagram of ventral aspect of the brainstem. So please write down the heading along with me, ventral aspect of brainstem. Now in the ventral aspect of the brainstem, let us see what are all the MCQs to be covered here. And let's get prepared for the image based questions also. So this one will be your pons, and below here this is medulla oblongata, and then just above this here there will be the midbrain wala part. Let us write down the names also, guys. Midbrain, and then pons, and then medulla. Now after drawing the diagram here, let us do one thing. Let us trace all the cranial nerves again here, guys, in this diagram. So from the midbrain you'll be having cranial nerve number 3 as well as the cranial nerve number 4, the oculomotor nerve and the trochlear nerve. Then from the pons you'll be able to find there'll be only one nerve coming out from here, and this is the trigeminal nerve, guys. And one more thing to appreciate here is that pons will be actually connected to the cerebellum behind with the help of cerebellar peduncle. Okay, between the pons and the cerebellum, I repeat again, there will be a cerebellar peduncle, middle cerebellar peduncle. So once there was a question in the exam, the trigeminal nerve, the fifth nerve, will be exiting out from where? Like its pons there, and then you will be able to see that is actually going and connecting with the cerebellum behind. This will be the middle cerebellar peduncle. So between the pons, middle cerebellar peduncle, that junction, from there the fifth nerve will originate. I repeat again, fifth nerve will come out from the junction between the pons and the middle cerebellar peduncle, cerebellar, not cerebral. Then from the pons and the medulla oblongata, you'll be able to find the sixth and the seventh and eighth nerve coming out. So this will be the sixth nerve, and then the seventh nerve, and then your eighth nerve here. Then in the medulla oblongata, guys, you'll be having a sulcus in the middle. Because of this, there will be one elevation here, and there will be another elevation here, pyramid. And then you'll be having lateral to that, you'll be having olive. So this is the olive here. Fine. Now, as I told you, we are going to cover like almost every MCQ possible here. You need to even know what is the reason for that elevation olive. Now, if you just say beneath that one, guys, suppose if this is the elevation olive, if you just say beneath that one, you'll be able to find one nucleus there, and that nucleus will be the inferior olivary nucleus. So because of that inferior olivary nucleus beneath that, on the surface, I am able to see the elevation there. Okay, so what is the reason for olive here? Olive will be due to inferior olivary nucleus. Okay, then the next thing is pyramid. Now what is the reason for this elevation, guys? Pyramid. And here you don't have to worry about that. It is due to the pyramidal tract. The pyramid elevation is actually formed due to the pyramidal tract. We have already learned in the category of descending tracts, there will be a pyramidal tract, also known as the corticospinal tract. It is descending down. And please try to recall that point. The pyramidal tract fibers will come in the medulla, especially in the lower medulla. You have to be careful. In the lower medulla, 85 to 90% of the fibers will be crossing. Okay, but 10% of the fibers will be remaining only on the same side, guys. Okay, so in the medulla oblongata, those fibers are descending down. The pyramidal tract fibers are descending down, and because of the pyramidal tract, on the surface you are able to see the elevation, that is pyramid. Now why I am stressing a lot the reason for this one? Why? Because recently in the AIMS exam they have given an image based question, and in that image based question they have marked this pyramid area. The pyramid region was marked, and in the arrow marked region, if there is a lesion, if there is an injury, then what is the consequences of that one? Obviously, the arrow marked region in the exam was pyramid, and pyramid is formed due to pyramidal tract. And if the pyramidal tract is gone, then what is going to happen? It will lead to hemiplegia. It will be leading to contralateral hemiplegia. Why? Because the crossing will take place in the lower part of medulla, not in the upper part. Okay, so that is the reason why you also have to know the reason for these elevations. Already these type of questions has been asked in the exam. Now once you are comfortable with this, let's go back to our same thing. Let's continue the sequence of cranial nerve. Till now 8 cranial nerve has been completed. Now the 9th and the 10th and 11th cranial nerve will exit out lateral to olive. 9th, 10th and 11th will exit out lateral to olive. In the cranial nerve nuclei topic, yes, I will even teach you about the common nucleus. The 9th, 10th and 11th will have a common nucleus, that is nucleus ambiguous. I hope you remember that one. Now between the pyramid and olive, the last and final one, the 12th cranial nerve will be exiting out. So 12th nerve, that is hypoglossal nerve, will exit out between the pyramid and the olive, guys. Perfectly done. So right from the very beginning of this topic, as I told you, right from the very beginning, 3rd to 12th cranial nerve will be originating from the entire brainstem, hence proved. So first we have done a schematic diagram, and now it is the exact diagram as it is present in our body. So I think now my students will not have any phobia if these type of questions are given in the exam, image based questions. Now let us go into some more details of this one. I don't want to leave anything here, sir. Fine. Now in this, I hope you're able to see this structure on the ventral aspect here of the midbrain. This structure is actually the peduncle, and it is cerebral peduncle. I want you all to be like more careful here, guys. Don't get confused between cerebellar and cerebral. So this is cerebral peduncle on ventral aspect of the midbrain. Hope you have studied. When you take a transverse section of the midbrain, you'll be able to find the tectum, then the tegmentum and the peduncle. Now try to understand, on either side, you'll be having the cerebral peduncle. And because you're having the cerebral peduncle on either side, in the middle, there'll be a depression. There'll be a fossa. I'm speaking about this fossa over here. So on either side, you're able to appreciate the cerebral peduncle, and in the middle, you're able to find a fossa, and this fossa will be referred to as interpeduncular fossa. Wow, a meaningful name here, guys. So between the two peduncles, interpeduncular fossa. Now I hope you have understood the name, but the most important thing is, what are the boundaries of interpeduncular fossa and what will be the contents of that one? It's extremely important, and it has been asked many times in the exam. Okay. And for understanding this one, guys, don't panic. Again, let's do the same thing here. Let's go back to our diagram here. First, let's learn or understand in this diagram, and then later on, we are going to draw our own diagram. Now in this, try to get the orientation here, guys. For example, if this one will be the cerebral hemisphere here, and in the cerebral hemisphere, this will be the frontal lobe. We all know here, just below the frontal lobe here, guys, below the frontal lobe, your eyeball. So try to correlate all the structures here, guys. So this is the eyeballs, and from the eyeballs, you'll be having your optic nerve and optic nerve on either side. And these optic nerves will cross here, and this crossing here will be known as the optic chiasm. And from the optic chiasm, you'll be having optic tract on one side and the optic tract on the other side. So just look at my fingers here, guys. For example, there is optic chiasm crossing, and then there'll be optic tract on one side and there'll be optic tract on the other side. Now between the two optic tracts, you'll be able to find the infundibulum, the pituitary stalk, and that will go and get attached to the pituitary gland there. So I hope you're able to appreciate there'll be a pituitary stalk, or we can call it as infundibulum. And that infundibulum will be always associated with that tuberous cinerarium. I hope you're able to see that bulged part there. There is nothing but tuberous cinerarium. Now behind the infundibulum, what else do we have? Yes, you'll be having a part of your limbic system, that is mammillary body. Behind the mammillary body, you're able to find the posterior perforated substance. Posterior perforated substance. Don't worry, I'll tell you like what is the reason why it is formed and all. And then if this is your midbrain, we all know, we are like perfect now. Okay, from midbrain, the third and fourth cranial nerve will originate. And guys, try to recall which cranial nerve will be this one now. It has to be definitely the third nerve. Why? Because sir has told very clearly, we have learned, we have drawn the diagram very clearly that the fourth cranial nerve will be originating dorsally, and we cannot appreciate in this diagram. The third cranial nerve is originating ventrally. So that's the third cranial nerve originating from the midbrain, guys. So let me just recall all the structures in order again. Why? Because now we have to see the ventral aspect. Okay. So first you'll be having the optic chiasma. Just behind that optic chiasma, there will be infundibulum, and that will be along with the tuberous cinerarium. Behind that, you're able to appreciate mammillary body here, and behind that there will be posterior perforated substance, guys. Perfect. And now try to understand this in 3D here, sir. Okay, it should be like an animation in your mind. So this is our midbrain here, this is our pons here, and this is medulla, that is your brainstem. And what I'm going to do is I'm going to turn this now in this direction. Diagram on the screen, whatever you are able to see here, it's actually in the cerebral section. Now let me turn that. Now once I turn, I'll be able to see the ventral aspect, and let me appreciate all the structures in the same sequence there. So once I turn that in the front, this is how the ventral aspect looks like, and I want all of you to please look at this interpeduncular fossa. Okay, so are you able to appreciate the infundibulum here, guys? Yes, and that is actually cut there. We have removed the pituitary gland from there. But that infundibulum is along with that bulged part, tuberous cinerarium. Then there will be mammillary body on one side here, there will be mammillary body on the other side here, and then there will be posterior perforated substance. And of course, no doubt about that, the cranial nerve number 3, guys. So infundibulum, mammillary body, posterior perforated substance, and cranial nerve number 3, all these 4 things are the contents of interpeduncular fossa. And that you can again appreciate on the ventral aspect of the brainstem, guys. Standing here, let's do one thing. After understanding everything here in this diagram, let's just register this in our notes here. Please write on the heading there as interpeduncular fossa. Now do one thing guys, just start this diagram a little bit from below so that we can just keep on adding the structures above. So this one will be your pons here. This will be the cerebral peduncle here on one side, and there will be like one more cerebral peduncle on the other side. So this is the optic nerve, and the crossing optic chiasma, and then you'll be having the optic tract here. Perfect. So this fossa in the middle here, this fossa will be the interpeduncular fossa. So we should know like two things about the interpeduncular fossa. One is the boundaries of that, and another thing will be the contents of that, guys. Okay. So let us first of all see what will be the boundaries of interpeduncular fossa. Yes. This is optic chiasma. This here will be the optic tract. And finally this here will be the cerebral peduncle. Of course, that will have that crus cerebri wala part. So in most of the books you will be seeing they'll be marking that as crus cerebri. Even that is also not wrong there, guys. Cerebral peduncle, it will have that white matter part known as crus cerebri. So don't get confused with that one. So all these are actually the boundaries of interpeduncular fossa. Interpeduncular fossa is bounded by this one here. Now once it is done, what are the contents, guys? It has been asked a lot of times in the exam. They will be infundibulum, and then mammillary body, and then you'll be having this posterior perforated substance, and of course the cranial nerve number 3, the oculomotor nerves. And let's do one thing here. Let us write down even the contents also, guys, so that while doing the revision you should not skip that. Okay. Infundibulum always along with tuber cinereum. Number 2, there will be mammillary body. Number 3, there will be posterior perforated substance, and finally the cranial nerve number 3, so oculomotor nerve is also a content of interpeduncular fossa. So I always request all of the students, guys, even during the live classes, to make notes by themselves. Better you draw the diagram by themselves, by yourself, guys, so that you don't forget the things. Okay, once you draw by yourself, you know, you will be learning with all the senses possible, and you will not be able to forget that one, guys. So instead of just listening to the lecture, better you also draw along with me. So we are done with the boundaries and the contents of interpeduncular fossa perfectly, guys. Now one thing I want you all to understand here is, if there is a posterior perforated substance, obviously you will also have the anterior perforated substance also. Now where is that? Now in this diagram, for example, here you will be having your olfactory bulb, okay, and that will continue here as olfactory tract, and this olfactory tract will be actually splitting here into that stria. Okay, so let me just mark here, guys. This is olfactory bulb. Olfactory bulb will continue as the olfactory tract, and that olfactory tract is actually splitting there. Now here you will be able to appreciate that there will be anterior perforated substance here, sir. Okay, so let me just write down here, there will be anterior perforated substance. Now why is this important? Why is this anterior perforated substance important? Why? Because recently in the exam they have asked the boundaries of anterior perforated substance. Now good thing here, the way we are learning here, guys, you already know the boundaries. On the medial side you will be able to appreciate the optic chiasma. On the medial side you will be having optic chiasma here, and just behind that anterior perforated substance, posteriorly you will be having optic tract. So medially optic chiasma, posteriorly optic tract. But what do you have on the lateral aspect? That was the question asked in the exam. So on the lateral side you will be actually having the insula, the hidden lobe, insula there. But in the options they did not give insula, they have given the name of that opening of that one, guys, and the opening of that is known as Lyman insulae. So on the lateral side you'll be able to appreciate the opening of the insula, that is Lyman insulae. So let us write down what are the boundaries of anterior perforated substance. Medially you will be having optic chiasm, and then posteriorly there will be optic tract, and finally, guys, laterally, which was asked in the exam, laterally you'll be having Lyman insulae. So these are the boundaries of anterior perforated substance. Perfectly done. So as I have promised you, we are going to cover like almost everything on the ventral aspect of the brainstem. So tomorrow in the exam, if they give you that image, everything you should be able to appreciate in the image, guys. Now, one last thing what is going on in our mind right now is that, sir, what is the reason? What is the reason for anterior perforated substance and the posterior perforated substance? Why it is perforated basically, and what is it, man? To understand that, we'll do one thing here. Let us just correlate our this diagram with the circle of Willis. Okay, so let me draw it again very quickly and draw along with me, guys, very quickly here. So if this is your pons here, then the medulla oblongata here, and if this one is your midbrain here, there will be a vertebral artery and the vertebral artery from the other side. Both of them will combine together to form basilar, and basilar artery will finally divide into the posterior cerebral artery, PCA. So vertebral artery here, basilar artery here, and this one is the posterior cerebral artery. And just now I told you this will be the interpeduncular fossa over here between the two cerebral peduncles, you know. Now the posterior cerebral artery present over there, that posterior cerebral artery, the branches of that one will be perforating the grey matter here, and that itself is nothing but the posterior perforated substance. So see how easy it is. Instead of just simply mugging, better learn with the image, learn with the diagram. It will be so easy. So what is posterior perforated substance? It is nothing but the grey matter which is perforated by the branches from PCA, posterior cerebral artery. Now similarly, I hope you all have learned circle of Willis nicely, and you can even watch my video on that. There will be internal carotid artery here, and that will further give rise to the anterior cerebral artery, ACA, and that will continue as middle cerebral artery and middle cerebral artery, guys. So this one is ACA and this one will be your MCA, the branches of internal carotid artery. And somewhere here you'll be having your anterior perforated substance, guys. Now you can clearly understand why is that anterior perforated substance created there, why it is perforated there. And without any doubt, again it is also the grey matter that is formed due to the perforations of branches from ACA, anterior cerebral artery, and then MCA, the middle cerebral artery. So better we'll write down here, just in short here, what is anterior perforated substance? So it's nothing but grey matter perforated by, yes, the branches of anterior cerebral artery and middle cerebral artery. Done. Then what about the posterior perforated substance? The posterior perforated substance, again it is also the grey matter, and that is perforated by the branches of posterior cerebral artery. No mugging at all. So we can conceptually understand, okay, why it is perforated and which artery, the branches of which artery is making them perforated, guys. That's all. So therefore now we have completed like anterior perforated substance, the posterior perforated substance, the interpeduncular fossa, and even the origin of all the cranial nerves. These cranial nerves are originating from where? They're beginning from where, guys? Fine. So in this manner, we are perfectly now done with the anterior or ventral aspect of the brainstem. So I suppose now all my students will not have any phobia in answering the image based questions about the ventral aspect of the brainstem. You can appreciate every structure there without making any mistake, guys. That's all. Done. So now after completing the ventral aspect of the brainstem, now let us move towards the dorsal aspect of the brainstem, guys. And again the same thing, I'm starting from the scratch here. First we'll see the diagram and all the details in the image here, and then we'll draw our diagram. Now in this will be your midbrain here, and this will be the pons here, and this will be the medulla oblongata. And just now we have seen the ventral aspect of the brainstem, guys. And now let us see the dorsal aspect of the brainstem. What all we'll appreciate there. First, let me show you behind the midbrain, guys. So behind the midbrain, I'm able to see here that there will be two colliculi. There will be like two superior colliculi, and then there will be two inferior colliculi. There will be two superior colliculi and there will be two inferior colliculi. And together, all those four bodies are known as corpora quadrigemina. The word corpus is coming from body, and quadrigemina, there are like four of them. So there will be like two superior colliculi, two inferior colliculi. That's all. No tension at all about the dorsal aspect of midbrain actually. So behind the midbrain, you will be just having the four, like, four bodies, the corpora quadrigemina. That's easy. Now what do you have like behind the pons and behind the medulla oblongata? And that is something important to understand. Now in this diagram, I am able to see that behind the pons and medulla, there will be cerebellum. Okay, fine. And we have already learned in the introduction of neuroanatomy, I told you that pons, medulla and cerebellum, belongs to your hindbrain, that is rhombencephalon. And in the rhombencephalon, the ventricle present here will be your fourth ventricle here, guys. Oh. And you can clearly appreciate the fourth ventricle will continue down here into the central canal of the spinal cord, and that will continue above into aqueduct of the sylvius that will connect that with the third ventricle. Oh. So third and fourth ventricle are connected by aqueduct of sylvius, and the fourth ventricle will continue down as the central canal of the spinal cord. Fine. Now in this diagram, try to understand that this will be the floor of the fourth ventricle. This is the floor of the fourth ventricle. And here this will be the roof of the fourth ventricle. This is the roof of the fourth ventricle. And you can clearly see and you can clearly appreciate in this diagram here, guys, the roof of the fourth ventricle is actually like invading into the cerebellum. It's like, moving into the cerebellum there, guys. The roof. So that's the floor and the roof. Now what is our topic right now, sir? Our topic is we have to see the dorsal aspect of the brainstem only. And to see the dorsal aspect of the brainstem, what I'm going to do here, I'm going to cut and remove this cerebellum from here. So let me just cut and remove the cerebellum from there. If I just remove the cerebellum from there, try to understand the orientation now. So if I'm cutting that cerebellum and removing from there, then what is going to happen? The roof of the fourth ventricle will also go away along with that. The roof is also gone, and directly when I'm going to see from behind the dorsal aspect, then what I'm going to see, sir? I'm going to directly look at the floor of the fourth ventricle. Wow, crystal clear. Understanding? So remember, from now onwards, what you have behind the pons and medulla, you will be able to appreciate the floor of fourth ventricle. So guys, just to summarize here, what do you have behind the midbrain? Behind the midbrain, you'll be having corpora quadrigemina. And what do you have like behind the pons and medulla, you'll be able to find the floor of fourth ventricle. Now, keeping all this planning in our mind, let us just turn that now behind, sir. So just now I've shown you the ventral aspect, okay, turning in the front. Let us turn it behind. Let me show you the dorsal aspect, guys. So look at this diagram now. So once we turn it behind, so this will be your midbrain here, guys. Okay, this will be the pons here, and then finally this one will be the medulla oblongata. And behind the midbrain, superior colliculus, inferior colliculus, and inferior colliculus. Together, the corpora quadrigemina. Perfectly done. And you can appreciate here, there was a cerebellum here. And we have cut and removed that one, sir. I told you already like how it is connected with the brainstem. The cerebellum behind and the brainstem, how they are connected with each other. They are connected with the help of peduncles, cerebellar peduncles, and you are able to see the peduncles cut there. So we have cut and removed the cerebellum from behind. And once you remove that, directly you are able to see that rhomboid fossa. Nothing but the floor of the fourth ventricle. It is actually rhomboid or diamond shape like this. So rhomboid fossa, nothing but the floor of the fourth ventricle. But even in this diagram also, guys, try to appreciate, I have slightly turned that. Now let me turn it completely for you people. Let's see the dorsal aspect of the brainstem now completely, guys. Wow, it makes a clear picture in your mind now. Behind the midbrain, last and final time, sir, superior colliculus, and this is the inferior colliculus and inferior colliculus. Don't worry about this structure here in the middle, sir. That is actually the gland, pineal gland. And yes, you are able to see the floor of the fourth ventricle directly. And these are the peduncles. And here I want you all to understand one thing. This is the superior cerebellar peduncle, and then this one is the inferior cerebellar peduncle here, and a little to that there will be middle cerebellar peduncle, guys. So basically what is happening is, don't think that all that cerebellar peduncles are individually attached to cerebellum. They are not like individually. The superior cerebellar peduncle is coming down, inferior cerebellar peduncle will be coming up, and the middle, all the three of them will together enter into the cerebellum. Understanding? And in that process, the middle cerebellar peduncle will be pushed a little bit more lateral. So whatever you are able to find like more lateral will be middle cerebellar peduncle, and then coming from above, no doubt about that, superior, and coming from below will be the inferior cerebellar peduncle. That is one thing to appreciate there. And one more thing to appreciate here, I want all of you to now shift your concentration to this part here, sir. Below. Guys, try to recall again, which aspect are we looking at? Are we looking at ventral or dorsal? Dorsal aspect. Now from the spinal cord, already in the spinal cord topic we have discussed, the dorsal aspect will have that dorsal column, and dorsal column will have two important tracts. One will be the fasciculus gracilis, another one is the fasciculus cuneatus. So on the medial side you'll be having the tract which is ascending up will be fasciculus gracilis. Gracilis, I told you to remember gracilis, G for gracilis and G for ground, that is coming from the lower limb. And then just lateral to that you can appreciate the fibers of fasciculus cuneatus. And we can clearly understand this, guys. Fasciculus gracilis is actually coming from the lower limb. Those fibers are coming from the lower limb. So they are like more medial. and they are actually joined on the lateral side by fasciculus cuneatus fibers coming from upper limb. So it makes sense gracilis will be towards the medial side and cuneatus will be towards the lateral side. And we have even learned, will they stop in the spinal cord? Absolutely no. The fibers of fasciculus gracilis and cuneatus will directly go and stop in medulla oblongata and in their respective nucleus. So I told you they will be stopping in their particular nucleus, that is nothing but fasciculus gracilis will be ending in nucleus gracilis nucleus, and fasciculus cuneatus will be ending in the cuneate nucleus here, and those two nuclei will be actually present where they are found in the medulla oblongata. And again the same concept here, because of that nuclei you are able to see two elevations there guys, and these elevations are known as tubercles. So here this will be the gracile tubercle, and lateral to that this one will be the cuneate tubercle. So nuclei will be present inside the medulla oblongata. Because of that nuclei there on the surface you are able to appreciate the two tubercles, and again thank God the names are quite easy: fasciculus gracilis, gracilis nucleus, and the gracile tubercle; fasciculus cuneatus, the cuneatus nucleus, and then the cuneate tubercle guys. So you are able to appreciate the two tubercles. Now why am I telling you about all these things over here? Why? Because yes, they are also a part of the boundaries of the fourth ventricle. So simultaneously what I am trying to do, I hope you are understanding the way I am actually concising all the topics into one topic here. So here itself, along with the dorsal aspect of brainstem, we are also going to learn everything regarding the fourth ventricle also. So fourth ventricle is bounded here by the peduncles, superior cerebellar peduncle and inferior cerebellar peduncle, but not the middle cerebellar. Middle cerebellar is more lateral. So fourth ventricle is bounded by superior and the inferior cerebellar peduncle, and the tubercles guys, gracile tubercle and the cuneate tubercle. Now once you are done with all those boundaries on the sides, then what are you able to appreciate in the floor of the fourth ventricle? In the floor of the fourth ventricle you are able to find like 4 elevations there. So in this will be the facial colliculus here. This is the facial colliculus here guys, and this here will be the hypoglossal triangle on either side, and then the vagal triangle and vagal triangle here, and whatever area is left out here, that will be the vestibular area here. So this is the vestibular area on the lateral side, and it is actually separated by a sulcus here. This sulcus is known as the sulcus limitans. Now don't worry about all this, so many names here, a lot of terminology here guys. We are going to draw this exact diagram, and in the diagram I'll make you write down everything. Understood? So in this image we have discussed everything here. Now let us do one thing, let's draw our diagram. In that I'll make you write down all the details. So better start drawing the diagram along with me now. So dorsal aspect of brainstem. So we have already seen ventral aspect in detail. Now let us learn everything on the dorsal aspect of the brainstem guys. So first, starting with the midbrain, what do you have behind the midbrain? Behind the midbrain there will be colliculi, superior colliculi, inferior colliculus and inferior colliculus. So let us write down the full name here: superior colliculi, and then this one here will be the inferior colliculi. And because there are like 4 bodies here, all these 4 bodies together they are referred to as your corpora quadrigemina. Corpora quadrigemina. We can understand the name very easily there. Corpora, the word comes from corpus. Corpus means body, and quadrigemina, quadri, 4 bodies. Now here itself, let me just recall in your minds, okay, what is the use of this one, or what is the function of this one guys? Superior colliculi, they are the one which are concerned with visual reflex. I hope you have learned about that optic pathway, the visual pathway. In that visual pathway you will come across the superior colliculi that is concerned with visual reflex, and inferior colliculi will be concerned with your auditory pathway guys. Auditory pathway. So just to have a clarity here itself, so that when we do the auditory pathway and all, we'll be able to appreciate that. So again I'm telling you here guys, superior colliculi are concerned with visual reflex, whereas the inferior colliculi are concerned with your auditory pathway. Perfect. And where do you have this? Don't forget that this is actually present behind the midbrain, on the dorsal aspect of the midbrain guys. So guys, we are done with the dorsal aspect of the midbrain. On the dorsal aspect of midbrain, we are having corpora quadrigemina. Now what do you have behind the pons and medulla oblongata? Behind the pons and medulla oblongata, I told you the entire planning there. We'll be having cerebellum. After removal of that, directly we are able to see the floor of the fourth ventricle. So let's draw the diagram for that one. Imagine this one is your middle cerebellar peduncle on one side, and there is a middle cerebellar peduncle on the other side. and this will be the superior cerebellar peduncle from above, and this here will be the inferior cerebellar peduncle from below here. Let us just write down their names here, guys. So this is the superior cerebellar peduncle, this will be the inferior cerebellar peduncle, and this one here will be the middle cerebellar peduncle. And in my diagram here you can clearly appreciate like what is forming the boundary of the fourth ventricle. It's only superior and inferior cerebellar peduncle. You can see middle cerebellar peduncle is like more lateral, it is not forming the boundary of that. And not only this, below what do you have here, as I told you, there will be a tubercle here, guys. On either side you'll be having a gracile tubercle and the cuneate tubercle. The gracile tubercle and the cuneate tubercle. So let me even mention their names also. So on more lateral side, what do you have, sir? Is it like cuneate or gracile? I told you the way how to remember this one. Cuneate, actually those fibers are coming from the upper limb, so it's more lateral, and gracile will be like more medial. That is gracile tubercle. So all these are going to form the boundaries of fourth ventricle. Now once you are done with the boundaries of fourth ventricle, let us appreciate the details in the floor of the fourth ventricle here. There will be a midline, or in the middle you will be able to appreciate there is a sulcus, and on the lateral side also there is a sulcus limitans here. Yes. So let's write down their names here, guys. There will be a colliculus first of all here. This colliculus is known as the facial colliculus. So this colliculus here is referred to as the facial colliculus. And this triangle that you are able to appreciate here, this will be the hypoglossal triangle. Hypoglossal triangle. And then this triangle here will be the vagal triangle. Vagal triangle. And then whatever area that you are able to appreciate on the lateral side here, this area here will be the vestibular area. Vestibular area. So these are the four elevations that you are able to see in the floor of the fourth ventricle. And now the most important thing, you need to even learn the reason, like why are they created, why are they formed there. Now it's so easy to understand, like it's very easy. Again, I'll tell you one example here. For example, let's take vagal triangle. Now why is that vagal triangle, why is that elevation created there? Again the same example, or again the same reason, guys. Beneath that you are able to find the nucleus of 10th cranial nerve. 10th cranial nerve, the vagus nerve nucleus. So because of that vagus nerve nucleus, or the vagus nucleus, on the surface you are able to find the elevation, and that has been named as vagal triangle. Similarly, hypoglossal triangle, hypoglossal nucleus. So let us just write down. So what is the reason for vagal triangle here? It's due to the 10th nucleus. What is the reason for hypoglossal triangle here, sir? It is due to the 12th nucleus. Hypoglossal nerve nucleus. Vestibular area, the vestibular area is due to the 8th nucleus, 8th cranial nerve nucleus. Fine, till here it is well and good. And now comes the most crucial part, the most important part, facial colliculus, where most of the students will be getting confused. Remember, my dear friends, facial colliculus is due to 6th cranial nerve nucleus. It is abducens nucleus, not the facial nerve nucleus. It is not the 7th cranial nerve nucleus, and that is what is extremely important here in the floor of the fourth ventricle. So in the floor of the fourth ventricle there will be facial colliculus, but remember, it is not formed due to the facial nucleus, it is formed due to the abducens nucleus. Now what is the reason for this one? Come on, try to recall. Hope you have learned about the facial nerve a lot of time, and there is something like internal genu and external genu. So for example, if you have got this one as the 6th nerve nucleus, if this is abducens nucleus, the 7th nerve will be actually taking a turn around that one, guys. Will be taking a turn around that one. That is your internal genu. And because of the 7th nerve taking a turn, on the surface there will be elevation. And that's why the name of the elevation is given as facial colliculus. It's due to the turn of the facial nerve. But if in the exam, if they ask you like which nucleus, it is the 6th nucleus. Okay, and that you can appreciate if you take a transverse section of pons. Fine. So let me just show you that one also, guys. Let us just draw a small diagram here of transverse section of the pons. So for example, if this one is your pons here in the transverse section, don't worry, like we are going to even learn the transverse section of the pons in detail. So if this is the transverse section of pons, and now if this is the ventral aspect here, and this is the dorsal aspect here. Be very careful, guys. It is not like the ventral aspect or dorsal aspect of pons. We are taking a transverse section of the pons. Now, somewhere here, you'll be able to appreciate the 6th cranial nerve nucleus, that is abducens. And then the 7th cranial nerve nucleus is more ventrally present here. So this is the 6th one, and this is the 7th nerve nucleus. Now, the 7th nerve will be originating from here, taking a turn like this, and then exiting out. And you all know very well, you are an expert in that one. 6th, 7th and 8th. Are you all able to recall? 6th, 7th and 8th. 7th and 8th. Yes, they are going to come out from where? Pontomedullary junction. So it is going to come out from the ventral aspect of the brainstem. Pontomedullary junction. Everything makes sense. Now, because of this 7th nerve taking a turn over here, on the dorsal side you are able to see a elevation here, and this elevation is said to be the facial colliculus. Facial colliculus, guys. So the facial colliculus is due to what? It is due to the 7th nerve. But if they ask you the nucleus in the exam, you have to be like really careful whether they are asking you the nerve or the nucleus. The nucleus will be the 6th one and nerve will be the 7th nerve. Sir. Is it okay? So you got to be like really careful. Why? Because they have already asked many times the questions regarding that one. If there is a lesion, if there is an injury in that facial colliculus, then which nerve is involved? It is facial nerve involved, affecting all those muscles of facial expression. And if they ask you nucleus in the exam, then it will be 6th nucleus, and if that is involved, affecting only the lateral rectus muscle. If you remember extraocular muscle and their nerve supply, that very famous formula SO4 LR6 rest all by 3. So LR6, 6th nerve, nucleus is involved, then it is going to affect your lateral rectus muscle. So there is a lot of difference between those two questions. Try to take care about that. Achha, why it is happening like that? What is the reason for this? Why is the facial nerve like more ventrally, migrating more ventrally? Hope you have learned about the concept of neurobiotaxis. Actually, what happens is, the 5th cranial nerve nucleus, let me just draw it with another color here. The 5th cranial nerve nucleus, sensory nucleus, will be present like more ventrally here. Just for the sake of understanding, I am drawing here like this. So that is actually the sensory nucleus. Now try to understand, when we have learned about head and neck topic, I told you from your entire face, the sensory supply will be by trigeminal nerve. And then in the entire face, whatever facial muscles of facial expression are there, they are supplied by facial nerve. And now there should be like a quick response between the sensory and the motor. The trigeminal, sensory, and the motor, facial, there should be a quick response of the reflexes. And because of that, for example, if this is that green colored one, the trigeminal nerve nucleus, sensory one, and this is the red colored one, that is your facial, the facial nerve nucleus will actually migrate and go ventrally. It has to be like more nearer so as that reflexes should be more faster. Understanding? And that concept is known as neurobiotaxis. Because of that reason, you are able to see that internal genu created, and because of that reason, the facial colliculus over there. Okay, I hope all the concepts are extremely clear now. This is the complete diagram regarding the dorsal aspect of brainstem. So we have seen behind the midbrain, behind the pons, as well as the medulla oblongata. Okay, and not only that, guys, we have even seen the floor of the 4th ventricle here, along with this dorsal aspect. We have seen the floor. So we have also seen the floor of 4th ventricle here. And this is also referred to as the rhomboid fossa. The floor of the 4th ventricle, and it is also known as the rhomboid fossa, guys. Perfectly done. Now, because we are dealing with even the 4th ventricle here itself, so let me do one thing. Let me just finish off the 4th ventricle here itself, guys. So let us write down all the boundaries of 4th ventricle and finish it off. So please write down the heading there as 4th ventricle. Now, what will be the boundaries of 4th ventricles? I already told you on lateral sides, it is bounded by the cerebellar peduncle. Which cerebellar peduncle? Only the superior and inferior cerebellar peduncle, not the middle one. And not only that, it is also bounded by the gracile and cunear tubercle. So those boundaries already I have shown you in the diagram there, guys. The superior inferior cerebellar peduncle and the gracile and cuneate tubercles. And apart from that, what else? What else will be forming the boundaries of the 4th ventricle? Apart from this one, let me do one thing. Let me just show you the diagram of this one, something like this here. For example, if this one's the midbrain, and then the pons and the medulla oblongata, and then behind here you'll be having your cerebellum, something like this. Drawn a little bit bone bigger. So behind here you'll be having your cerebellum here like this. And imagine this one is actually the 4th ventricle here like this. Fine. So on the sides it is bounded, I told you already. And I don't have to discuss again with you people about the floor. Floor, just now we have discussed in detail the rhomboid fossa. Now what about the roof? What about the roof right now? So in this diagram, that is what I'm trying to teach you here. Here you'll be having medullary velum. Okay, and it is said to be the superior and then the inferior, guys. So one will be the superior, another one will be the inferior medullary velum. Medullary velum. Okay, so let us just write down. So what is forming the floor of the fourth ventricle? You don't have to learn it again. Just now we have discussed in detail, that is rhomboid fossa. Then what is forming the roof of the fourth ventricle? The roof of the fourth ventricle is formed by superior medullary velum, and then there will be inferior medullary velum. And out of these two, remember, the superior medullary velum will be actually a nervous structure. It is nothing but white matter only. Okay, so basically it is a nervous structure that is made up of white matter bundle only, bundle of axons. Okay, whereas the inferior medullary velum will be a non-nervous structure. It is actually the extension of the pia mater itself. So remember, it is actually a non-nervous structure. So by this we complete the floor, the roof, as well as laterally it is actually bounded by the superior inferior cerebellar peduncle as well as the cuneate and gracile tubercle, guys. So on the dorsal aspect of the brainstem, let us go back to the same diagram again. Now my students are expert. If they give you this image in the exam, I'm sure you'll never make a mistake in this one. So by this we have completed the ventral aspect of the brainstem as well as the dorsal aspect of the brainstem, guys. That's all. Done.